The pharmaceutical industry is working hand in glove with government to make sure Canadians do get access to vaccines. The statements made earlier, I think, were just misinformed. So as an example, we have a very large facility through one of our companies, GlaxoSmithKline, GSK, based outside Quebec City. They produce almost all of the flu vaccines for the country and have responsibility for pandemic vaccines as well. And in North York, we have Sanofi, which is a major North American center of excellence, not only for the production of vaccines, but for the research and development that goes on behind them.
So what would it mean then for Pfizer, Moderna, AstraZeneca, if we could fire up these facilities and start producing this vaccine? How does that work?
Yeah, I mean, it's not quite that simple, as I'm sure we all know. You don't just build some bricks and mortar and get this thing going. We're dealing with discovery, with innovation that just hasn't existed before. It's brand new, and so it's not as easy as it might sound. What I would focus on, though, is that I believe that there's certainly a willingness and a capacity for the pharmaceutical industry to step to the plate. The problem is, over the last many, many years, the environment in Canada has not been conducive to that. This is a global industry. You have a lot of competition. Most countries, frankly, don't have domestic capacity. The system has been set up differently. But we do compete to bring the investment dollars and the production capacity into our own country. But over the last many, many years, if you don't have a good system of patent and data protection, if you don't have a good pricing system in place, if you don't have good access and shorter times to listing, you're not going to be able to convince this global industry to come to this country. That's been our problem.
So these other countries then, Pamela, that are talking about vaccinating as soon as next month, which is just days away, are they producing vaccines for their domestic populations already?
Well, the ones that we're hearing about are the countries that I understand, yes, do have domestic capacity. So you hear a lot about the United States, of course. You hear about UK, you hear Germany. These are the countries that have really created a very viable business environment. And like it or not, the creation of pharmaceuticals, medicines, drugs, this is a business. And so they've created the environment that allows this industry to thrive. And so they tend to be front of the line. Now, I don't want to take away from our Canadian companies and CEOs that are fighting every day to make sure that Canada is as far to the top of that list of access as possible, that the production is as close to this country as possible so we can get it. But you're right in the sense that we don't have it in-house, and the countries that do have that production capacity are likely going to get it sooner than every other country.
And just quickly then, Pamela, a final thought. Is it too late for us to start producing it?
Well, you never say never. I think where there is a will and where the science allows that to happen, I think with all of us rolling up our sleeves, not just to get vaccinated, but to get the hard work done, that's a possibility. Again, it requires all partners at the table. If I can just say, we have been trying, even pre-pandemic, to work with the government and provide solutions to a number of problems we have in terms of pharmaceutical access in this country. But there has not been a huge listening ear. So we stand committed to have those conversations and working with any government. I just heard Premier Ford, where we've had some very limited conversation with the current federal government. We are ready and willing to get to that table and see what might be possible.
Pamela Fralick, she's the president of Innovative Medicines Canada. Pamela, thank you so much for your time.
Thank you as well.